Hi everyone. Today we are discussing the case of a young female patient, about 28 years, with a extraforaminal disc herniation at L3L4. This is the patient's MRI. As you can see, there is a apparently small disc herniation at L3L4 that's visible in the axial cuts, and it's barely visible at the sagittal cuts. But as you can see here in the coronal cuts, the hernia is not as small as we thought. It's compressing the L3 nerve root and causing a lot of pain. Our goal in this surgery was to land with our endoscope exactly over the hernia, so we can remove it without traumatizing the surrounding tissues. With that objective in mind, we did our preoperative calculations and decided to do the skin entry point at 7 centimeters from the midline. Here in red, you can see the intended trajectory of the needle. This is our intraoperative X-ray guidance, and you can see we have the needle in the desired position, because in the AP we can see the point of the needle in the lateral pedicular line, and in the lateral projection we can see the point of the needle in the posterior border of the vertebra. So this was a really short surgery. As you can see in the initial view, there is some disc material going out of the breach in the disc annulus, and we're going to start to do some coagulation and to define the borders of the hernia. The idea here is to dissect the hernia from the breach in the annulus to make the whole fragment loose, so we can remove it as a single fragment. So here is the structure of the fragment. That's similar to the one we observe in the preoperative MRI, and that concludes the surgery.